But I think once you have a child too, you want to just do what's best for them and do everything you can for them.
Natasha Adler's baby girl had an issue with her head, noticed first by her doctor, who recommended treatment at Summerside Children's and Sports Physiotherapy.
So she just did like a head to toe check, so similar to like what a GP would also do. She noticed she had like hemiangiomas, which is like a little birthmark on the head as well, something that I would have never thought like a physiotherapist would like look out for as well.
The clinic is co-owned by a pediatric physiotherapist. Liz Zahari says she diagnoses and treats a wide variety of problems in kids.
I work with kids who have issues with development, musculoskeletal injuries, any issue with movement, so neurological things, musculoskeletal things, primarily in babies.
Zahari says she's noticed an influx of patients since COVID. Children with medical needs without access to a pediatrician or sometimes even a family doctor, and parents seeking medical care and taking matters into their own hands.
And what we really noticed at that time was an increase in the acuity of what we were seeing, because we would have children who maybe parents thought they had torticollis, where they couldn't move their head equally, and it turned out to be cerebral palsy.
Zahari says that as parents lose access to pediatricians and family doctors in Alberta, clinics like hers have become a first line of defense for parents.
Parents should really follow their instincts. Parents know when something's not quite right, and if you're not sure, it doesn't hurt to come in and have a second look. And we are very experienced in seeing what is normal and what is not.
Zahari warns parents not to wait. You do not need a referral to see a physiotherapist, and often with infants and small children, corrective action is better sooner rather than later.
So for an example like torticollis, 90% of the time it will lead to a skull deformity called plagiocephaly. The earlier we can intervene, the more likely we are to be able to correct that with conservative strategies like repositioning and fixing the neck so that we can fix the head. If we wait and see, we lose that window of opportunity. So the cost of physio is something, but it is a lot less than getting a helmet, which is usually over $4,000 and is not covered by Alberta Healthcare.
And Adler agrees. Her baby has graduated from physiotherapy, her issue corrected by the time she was 7 months old.
If you've noticed something in developmentally that you want to get checked out, that you haven't been able to get a hold of a GP or another kind of medical professional, they definitely deserve like a seat at that table.
In Edmonton, Bianca Millions, City News.